to perform a productive or effective evaluation of a patient, the physician will often need to rely on visual cues or things that they can feel underneath the skin within a patient. Therefore, a proper understanding of the structures that are in the surface of the skin, that we refer to as surface anatomy, is an essential foundational set of knowledge that a physician must rely on. Let's begin with looking at some of the surface anatomy that can be palpated or felt within the inguinal region. First, a physician can almost always palpate or feel the iliac crest, the large prominence of bone on the lateral aspect of our hip that we can better see on the side of the body here that does not have the skin. If the physician were to follow the iliac crest anteriorly, they will arise at the point known as the anterior superior iliac spine, or the ASIS for short. This is going to be the lateral attachment of the inguinal ligament, which is going to pass inferomedially along the crease between the abdomen and the thigh, to the point where it attaches medially at the pubic tubercle. Typically, in most patients, the pubic tubercle and the ASIS can be readily palpated. In a very thin individual, a physician might even be able to palpate the pubic symphysis in the midline. On the thigh, we're going to be able to palpate certain structures in thinner individuals more readily than larger individuals, such as the greater trochanter, the large prominence that is for gluteal muscle attachment on the lateral aspect of the hip. At the knee, a physician can palpate the distal aspect of the femur, with the lateral epicondyle and medial epicondyle of the femur readily palpated on the lateral aspect and medial aspects of the knee, to either side of the centrally located patella, which is perhaps the most readily identifiable surface anatomy within the body. Inferior to the patella to either side, a physician can palpate both the lateral and medial condyles of the tibia, just distal to where the patella is going to slide over the proximal end of the tibia. Near this location, a physician can also palpate on the lateral aspect of the knee the head of the fibula, which is going to be an attachment site for the fibularis longus and brevis, just inferior to the knee joint. They can also palpate Gerdy's tubercle, typically along the lateral aspect of the knee, as well as the tibial tuberosity. The tibial tuberosity is going to be the distal attachment of the patellar tendon or ligament that is going to attach from the patella down to the tibia. Inferiorly, at the ankle, along the lateral aspect of the ankle, a physician can easily palpate the lateral malleolus, which is the distal end of the fibula, as well as the medial malleolus, which is the distal end of the tibia. Typically, the tibial crest, or the anterior aspect of our shin, can readily be palpated, which will then lead inferiorly to the medial malleolus. Lastly, within the foot, a physician can palpate the different metatarsal bones that are going to be within the central aspect of our foot, as well as the different phalanges in the toes.